This mirror image on the other side, the sphenoid bone. We have the ethmoid bone, which is associated with the sense of smell. Okay. And here we're looking at a top view down into the cranial vault. You can see a little detail on the ethmoid bone. Part of the challenge is just kind of learning how they all fit together. This is the sphenoid, which passes all the way through, as you can see, and this cavity right in the center of the sphenoid is the sella turcica, which is the residence of the hypophysis, the pituitary gland. What are we looking at here?
The
Condyloid process of the mandible, because the mandible articulates with the temporal bone, but the temporal bones have been removed. Sella turcica means Turkish saddle. Here we see the dorsum celli, which is the back of the saddle. Okay. What do you think foramen magnum means?
huge hole.
Big hole. And what do you think comes in and out of this?
Spinal cord.
Spinal cord, yeah. Here we have occipital bone in the back. Okay. So this is the frontal bone is up here, and we have the frontal crest, which helps separate the two hemispheres of the brain. So here's a posterior view. Right here we see your smart bump, which you can palpate in the back. Your external occipital protuberance. And we see some of the sutures, the joints in between the cranial bones. This is the lambdoidal suture. This is the sagittal suture for obvious reasons. And the pair of parietal bones. These words will be household words because the lobes of the cerebrum are named after the bones that they underlie in large part. Here you see just a little bit of temporal bone. The mastoid process, which is this bump behind your ear, is your mastoid process that you can palpate. Your sternocleidomastoid attaches to that. Okay, so we see temporal bone with the so-called zygomatic arch. This is the zygomatic process, or just the zygoma, if you like. Zygoma means cheek. What muscle slides in and out underneath the zygomatic arch?
Masseter.
A masseter. Okay. So we start to become familiar with some of the names. Lots of good stuff in this temporal bone. Okay, here we see a temporal bone, the styloid process, and the zygomatic process. The flat part is called the squamous region. What does squamous mean? Flat. Okay, the external acoustic meatus, or external auditory meatus, is the hole that you hear through. Mastoid process, back here. A very porous region with so-called mastoid air cells inside. Okay, this is an inferior view looking up. Looking at the occipital bone, you can see one of the two occipital condyles. And when your head rocks back and forth, forward to back, the occipital condyles articulating with the superior articular facets of C1. Okay. And the temporal bone, some very important holes, the jugular foramen and the carotid canal. Okay. The sphenoid bone has some really important holes as well. Here we see the foramen spinosum and the foramen ovale and the foramen lacerum. Okay. Nice view of the palatine bone. Another view of the temporal bone, but you can also see the sphenoid. with the sella turcica. The sphenoid bone looks like a butterfly with the greater wing and the lesser wing of the sphenoid. Here we see the ethmoid bone here articulating right on the midline with the sphenoid. And we see the jugular foramen and the carotid canal. The carotid artery contains 2/3 of the blood flow to the brain. It doesn't just go through a hole. The carotid canal is always shown in black because the moment it enters the cranium, it turns a 90-degree turn and runs horizontally for a while before it turns upward again and empties and splits into the 2 internal carotid arteries on either side of the sella turcica. All kinds of really heavy stuff happens around the sella turcica. The optic nerves cross just above the sella turcica, and lots of really crucial anatomy right there. Okay, the condyloid process of the mandible articulates with the mandibular fossa of the temporal bone. There we have the mandibular fossa just anterior to the external auditory meatus. Greater wing of the sphenoid. So just behind your eyes, you can palpate your sphenoid on either side. Okay. So we have zygomatic arch, squamous region, external auditory meatus, mastoid process, the things we can see there. All of the organs of hearing are located inside the temporal bone. Okay. Jugular foramen, carotid canal, sphenoid bone. Okay. This is the vomer, which forms part of the nasal septum. A septum is a wall between 2 chambers, and the nasal septum is right on the midline in between the 2 halves of the nasal cavity. So here we see the posterior view, and I've used this picture to ask questions on quizzes before. And we see the frontal crest there. This is the supraorbital fissure in the orbit. All kinds of good things pass through that. The back of the saddle, the dorsum celli. So all of this is the greater wing of the sphenoid. Right there. So this is what a sphenoid bone looks like posteriorly, the posterior view, and this flat part right here articulates with the occipital bone. I've asked that on quizzes before.
What's the name? What name do you give that?
The part that articulates with the occipital bone. That's best I can do.
All right.
Yeah, good question though. The legs of the butterfly are called the pterygoid process. And here's the greater wing on either side and the lesser wing. And the carotid canal right there, the optic canal. And the optic canals come at a 45-degree angle because after all, the optic nerves are going to cross right over the sella turcica.
Is that the same as the optic foramen?
Optic foramen, that's fine, yeah. Okay, and so here we see a top view, and you can see the greater wing, the lesser wing, looking down into the sella turcica, the dorsum celli at the back. And we see the foramen spinosum, the foramen ovale, and the foramen rotundum. The maxillary branch of the trigeminal nerve passes through that, the mandibular branch through that, the middle meningeal artery through that. The reason I tell you those things is so you can see that these holes are all important. So, where's the sphenoid bone on this?
The dark blue one.
Purple one there, isn't it? Okay. What's that one? Well, it's right there. So, what's that one? I had to name it. Rat. Foiled again. Okay, moving on. So, looking down into the Selaturcica, the spelling's kind of tricky on that. Okay. 2 C's, no S's. Okay, and the 4 little corners of the Selaturcica are called the clinoid processes, posterior and anterior. So, what's this? Dorsum celli, the back of the saddle. This is the frontal crest. This is greater wing and lesser wing of the sphenoid. Just in front of this dorsum celli is the Selaturcica. You can't see it. This is a supraorbital fissure, which you should be able to see through that, unless there's an eyeball in there. Because it opens, you'd be looking straight out the front of the orbit. So, this ethmoid bone is kind of hard to see anything on it, but this is an anterior view. The one feature that stands out is this one right in the center, is the perpendicular plate of the ethmoid. And I almost always ask that. Our next test, by the way, will be the lab final, correct? Okay. And you won't be quizzed on this material, but it will be included big time in the lab final.
How many
So-
questions are gonna be in that one?
I don't know, 20 or 25, I'm sure. Oh, there's 50 questions with additional extra credit. Okay. There's a protuberance that sticks out the top called a crista galli. Shows up beautifully on my little backyard skull. The perpendicular plate of the ethmoid is practically impossible to see. They don't show it on plastic models, but you can see it on that perfect cranium that I have back in the cupboard, which I won't be using because I really just don't want to damage that. So we'll leave it in there, but feel free to open the door and look at it. And the detail inside the nasal cavity is really amazing. You won't see that anywhere. Here's the perpendicular plate of the ethmoid. Okay, the ethmoid participates in the orbit. There it is. Lacrimal. Okay. Can't see the palatine bone. Maxillary, zygomatic, frontal. The sinuses, of course, don't show up in models but my backyard skull shows the frontal sinus beautifully because it's been cut right through there. And so you just know I'm gonna ask that, okay? The sphenoid sinus shows up, is easy to locate because it's right in the center of the cranium. So if you look at a mid-sagittal MRI, you will always see the sphenoid sinus. The largest sinus is the maxillary sinus, and that shows up nicely on axial slices. Okay. But they're cavities in the bone. The only purpose I can think of, and it probably is the purpose, is to make the cranium lighter. Okay. Of course, they're helpful in making our voices more resonant. Whether or not that plays into any reason for having them, I don't know. The nasal conchae are little baffles that the air swirls through in our nasal cavity. There are 3 sets of nasal conchae. Conch is the Latin word for snail shell. Okay? They used to be called, the older word is nasal turbinates. They're kind of swirly, have kind of a swirly appearance. And the air swirls through those baffles and becomes warmed and moistened. Okay? The nasal septum is formed from 2 bones, the perpendicular plate of the ethmoid and the vomer. The vomer has no other reason for being than for participating in the nasal septum. The rest of it is cartilage. Okay? Excuse me. Frontal sinus, sphenoid sinus, palatine bone, palatine process of the maxilla. Oh, that was on the lab quiz. Okay, these are the little holes that go from the nasal cavity up into various of the nasal sinuses. They're called paranasal sinuses. If those little holes get clogged up, you're in big trouble. There are surgical procedures by which they can be opened. So here's a coronal view a la Netter of what the nasal conchae look like. Inferior nasal conchae are separate bones. The middle nasal conchae are the next ones up, and the superior nasal conchae are further back. They're sort of retrograde back, so it wouldn't show up in this slice. There they are. You can see the superior nasal conchae with their posterior location. Sphenoid sinus. The inferior nasal conchae are separate bones. The middle and superior are part of the ethmoid bone. Okay? And the vomer is the Latin word for plow. So here's the inferior nasal concha, is a separate bone. The middle and the superior are part of the ethmoid bone, shown in green here. The cribriform plates of the ethmoid are very important in the sense of smell. They're very porous. They don't show up well at all on our plastic skulls, but they show up beautifully on my little backyard skull. You can see what they really look like. With all the little holes that pass up from the olfactory receptors on the roof of the nasal cavity here, up through, pass through, and connect to the olfactory bulbs of the brain, which lay one on each side of the crista galli, right on the floor of the cribriform plate. So the cribriform plates are very important in the sense of smell. The crista galli is used to anchor the brain. There is the brain attaches to the crista galli to keep it from flopping around inside the cranial vault. And I don't know why I put this on here. It's practically impossible to see anything. What do you think S stands for?
Sinus?
Sphenoid sinus. But this probably stands for hypophysis. But I mean, not much that you can really see. What do you think that stands for? Frontal sinus? Okay. So kind of hard to see much on a radiograph. Don't try this at home. You could pass, if you just had a cranium, you could pass a pencil through it. And here we see a beautiful MRI showing the nasal concha. This person, conchae is the plural of concha. This person has bone cancer. Not a nice situation there. So that obscures the superior nasal concha. But here we see the inferior and the middle nasal conchae. The maxillary sinus, the largest of the sinuses, is, you look at a cranium and it's hard to imagine where that sinus is, that it's so large, but shows up really large on medical images. The most interesting part of this, though, is the nasal septum, and you can see the articulation between the two bones. The superior part is the perpendicular plate of the ethmoid, and I have asked that in lab quizzes before. And the inferior part, of course, is the vomer. Okay. So it's perpendicular plate of the ethmoid and the vomer. This is actually a CT because you see all the artifacts down there. And there's that one showing the mastoid process, a little bit of the sphenoid sinus, mastoid process. And here we see beautiful maxillary sinuses. So, and the mastoid air cells. So these mastoid air cells are rather pervasive. This is a great axial MRI showing a little slice right through the sphenoid bone, and right there is the hypophysis, dangling by its little stalk there. Okay. And this big black hole, what do you think that big black hole is?
Maxillary sinus?
Good guess, but it's the sphenoid sinus. Okay? And the sphenoid sinus is going to be inside the sphenoid bone, which that is part of it. And this is the dorsum celli right there. And this, you can't see this part of the bone, it's so thin, but this is sella turcica, that's completely filled by the pituitary. And that's all we have.